How often should imaging be repeated?
So starting with smoldering, I would usually recommend once a year, or if there are changes in the serological markers, if there's a rise of M protein or hemoglobin lower, calcium higher, creatinine higher, so other reasons for suspicion of progression, then I would repeat again. In symptomatic myeloma, we do the first diagnosis to assess the disease after treatment to see how much is left of the disease. And with the newer techniques, if we use PET-CT and low-dose CT and MRI, it's usually enough to do another imaging at relapse or at any sign of serological changes. I had a few patients who had no changes in serological markers but had changes in the bone marrow. So sometimes it's warranted there. PET-CT helps us also beyond just the myeloma assessment. We also learn about if there are other tumors developing, because we know that up to 10% of patients can develop secondary cancers after high-dose chemotherapy with lenalidomide maintenance treatment. So that's another kind of additional question that we can ask for imaging after treatment.
Imaging should be repeated for patients to look at their myeloma bone disease whenever their myeloma is out of control and at very short intervals if their disease continues to be out of control. If their myeloma is in good control, especially if patients are in remission, they don't need any evaluation for their myeloma bone disease in the vast majority of patients. There are some rare patients that can potentially develop a non-secretory relapse disease that can affect and lead to fractures, and you wouldn't know based on looking at their monoclonal protein. I've been doing this for 12 years, and I've seen one of those patients.
Well, usually when I start treatment and the patient had as a baseline a PET-CT, after the treatment to determine remission, I do also a PET-CT to see whether the activity in the PET-CT has gone down. So this is important because we know that a complete remission is not only defined by the loss of your M spike, it's also defined by a normalization of the activity in the PET-CT. But again, all patients at the baseline, also at the determination of your remission status, or in case you are concerned that you might have a relapse, or your doctor is concerned that you have a relapse, we should repeat the imaging technique such as PET-CT or whole body CT scan.